Hello everyone, welcome back to our YouTube channel Dental Mnemonics, the channel where learning is smart and fun. We are again back with our Cracking Neville's Oral Pathology series. Today we'll be discussing Reiter syndrome, also known as reactive arthritis. As you can see in our title page, there is a strong association with Reiter syndrome where the person can't see, can't pee, or can't climb a tree. This is a very helpful triad to remember. So let's discuss in brief. So as I said, in Reiter syndrome, we have a triad in which a person can't see, he can't pee, or he can't climb a tree. So let's discuss this in brief. First triad is that the person can't see, which we associate with conjunctivitis. The second triad is that the person can't pee, which we associate with non-gonococcal urethritis. Usually urethritis is the first sign and is seen in both affected males and females. Females may also have inflammation of the uterine cervix. Also, conjunctivitis usually appears concurrently with urethritis, and after several days, the third triad, that is, can't climb a tree, the arthritis ensues. So you might think the video is over, right? Of course not. Now let's try to associate all of these triads with some other important features we see in Reiter syndrome. So first up with can't see or conjunctivitis. So it's obvious that if a person has conjunctivitis and he can't see clearly, they won't be able to observe or understand the geography around them, right? So here the geography stands for geographic tongue, as you can see in this figure. So geographic tongue is one component of reactive arthritis, probably because geographic tongue bears a superficial resemblance to the lesions of balanitis circinata, which is a new term which we'll be discussing now. So next we come to can't pee or urethritis. So if a person can't pee properly, they must have some inflammation on their glans penis, right? So patients with Reiter syndrome often have some skin lesions which take the form of a characteristic lesion of the glans penis, as you can see in this figure, called balanitis circinata, which resembles the superficial lesions of geographic tongue which we discussed in point 1. Now, lastly coming to can't climb a tree or arthritis. Why? Because his legs were sore. So here the sore stands for psoriasis. So the histopathologic findings of the cutaneous lesions in patients with reactive arthritis are frequently similar to those found in patients with psoriasis, particularly with respect to the presence of microabscess, also called as Monroe's abscess or Coy's abscess, which you can see in this figure, within the superficial layers of superficial epithelium, along with hyperparakeratosis and elongated or thin retipex. So next up, let's do some singing or rhyming with me. So chime in with me, say can't see, can't pee, can't knee, HIV. Repeat again, can't see, can't pee, can't knee, HIV. So this means that with some frequency, patients infected with Reiter syndrome are also associated with HIV infection. So before I end this video, let's talk about the genetic marker for this syndrome. I always like to associate things with general knowledge and facts. I guess everyone has recognized the person in this image. Yes, you got it right. He is none other than Nelson Mandela, who spent 27 years in prison and went on to write his autobiography, The Long Walk to Freedom. So relate Reiter with him and 27 to the genetic marker, which is HLA-B27. So I'd like to sum up this in a table which I like to do for other videos. So first we started with the mnemonic: can't see, can't pee, can't climb a tree. Can't see was conjunctivitis, can't pee non-gonococcal urethritis, and can't climb a tree arthritis. So the order of the symptoms is that first urethritis usually occurs in both males and females, followed by conjunctivitis and then arthritis. So we related each term to some other features. First up, can't see conjunctivitis. So if a person can't see, he can't observe the geography around him. So the geography was for geographic tongue. Can't pee. If a person can't pee, then he must have some lesions on his glans penis, which was called balanitis circinata, which resemble the superficial lesion of geographic tongue. And last one, can't climb a tree or arthritis. Why he could not climb a tree? Because his legs were sore. So sore was for psoriasis. So the histology of psoriasis is similar to reactive arthritis, where we see those microabscess, hyperparakeratosis and elongated retipex. Then we did some singing. So do it once again with me. Can't see, can't pee, can't climb a tree or can't knee, and HIV. So this says that reactive arthritis has frequently been seen associated with HIV infection as well. And finally, for the genetic marker, like Nelson Mandela's 27 years in prison relates to the genetic marker of reactive arthritis, which is HLA-B27. So that's it for today. I hope this makes your understanding of Reiter syndrome crystal clear. If you liked this video, hit the like button and subscribe to our channel for more exciting medical contents like this. If you need any help regarding any field of dentistry, feel free to comment down in the comment section, or you can also DM us on our Facebook, Instagram and TikTok page. The links are given in the description box. So let's end today with a quote from our writer Nelson Mandela, concluding our discussion on Reiter syndrome. It always seems impossible until it's done. See you all in the next video. Take care.